All right, guys, we are going to go over the Medicare for All resolution. I'm going to try to be as thorough as possible with this document, but I'm also going to try to move quickly so that this video isn't too long. So, of course, the resolution is resolved. The United States federal government should enact the Medicare for All Act of 2019. Important to note here that it's about a specific piece of legislation, the Medicare for All Act of 2019, not about Medicare for All generally. It's about this specific proposal for Medicare for All. So let's start off. What is Medicare for All? Medicare for All is basically just a name for a government program that would completely replace all private and public health insurance with what's called a single payer system. It's called a single payer system because there's only one entity paying for health insurance, and that's the government. It would provide healthcare to all Americans at no cost, except for any taxes which might have to be created to fund the program. But apart from those taxes, you wouldn't have to pay, like when you go to the hospital, there wouldn't be a bill, everything would be covered. Or when you go to see a doctor or get prescription drugs, you wouldn't pay. The only way people would pay would be through taxes. So let's start off with reasons why this would be a good idea. So the first reason is it would reduce overall costs in the healthcare system. So there have been a lot of studies that have shown that Medicare for All would overall reduce healthcare spending in the US. I cite a few here. There was a report that looked at 22 different studies, and all 22 found that it would reduce overall healthcare spending in the United States. There was a Yale study that was published in The Lancet. This study is pretty popular among members of the left who support Medicare for All, said it would save $450 billion every year. And even the Mercatus Center, that's like a right-wing think tank, even they found that it would reduce overall spending. So one thing that's kind of important to note is that it would increase, right, healthcare spending by the government, right? But because the government would take over all of the healthcare spending in the US, the overall amount of spending would go down. There are three reasons it would reduce costs. The first is there would be less administrative costs, so it would just simplify the whole system, right? Right now we have this complicated system, all these different government programs, all these different private health insurance companies. We would get rid of all of that. It would make things simpler, save money on paperwork, administration, etc. The second reason it would save money is what's called collective bargaining. Basically, if the government's the only person buying health insurance in the whole country, they have a lot of power to negotiate with like the people who make prescription drugs or the people who make like heart monitors or pacemakers to reduce those prices. And finally, it would take away completely insurance industry profits. So right now, insurance industries, private insurance companies, they make a profit, right? That's extra money that they keep apart from what it costs to do something. Medicare for All would be nonprofit. So theoretically, any profits that would normally be made by a private health insurance company, right? That would just be kept by the people, right? Okay. Reason number two, under Medicare for All, everybody would be covered and have health insurance, right? So that's by definition, Medicare for All would cover everyone in the US. Basically, the argument here, the current system isn't working for everybody is the argument. Right now, a lot of people in the US are uninsured. 44 million is the most recent number. It used to be closer to like 23 million, but because of the pandemic and the recession, that's gone up a lot. 30% of Americans say they've delayed medical care because of the cost. 1 in 5 Americans, 20%, can't afford to fill their prescriptions. And 2/3 of all bankruptcies in America are linked to medical issues, right? So a lot of problems with the current system with people being uninsured or underinsured. It's also worth mentioning, basically every other rich Western nation guarantees healthcare to their citizens, and the US is the richest country in the world. And the big impact is basically that lives would be saved. That's really the point here. The Yale study I mentioned before that was published in The Lancet said it would save 68,000 lives every year. That's a lot of people whose lives would be saved. Another reason, Medicare for All would de-link employment with health coverage, right? So right now, about half of all Americans get their health care through their job, through their employer. And Medicare for All would get rid of that. It would say whether you have a job or you don't have a job or no matter what your job is, everybody gets coverage, right? If you're retired, if you're a baby, if you're unemployed, if you're employed, everyone gets Medicare for All government health insurance, right? So There are a lot of arguments that right now the link between employment and health coverage, getting your health insurance through your employer, is a problem. COVID has really kind of highlighted that, right? Because COVID created a recession. So a lot of people are losing their jobs, which also means they're losing their insurance, right? During a pandemic. So the pandemic, right, caused a recession. So all these people lost their insurance right when they needed it the most, because of course there's a pandemic, right? Medicare for All would fix this. If you lost your job, you would keep your insurance. Second of all, some people argue it would help with kind of innovation. So right now, there's an argument that a lot of people are afraid to leave their jobs because they wouldn't have health insurance anymore, and they can't start a new business, right? Leave their job and become an entrepreneur because they don't want to lose their health care. This would make it so that that would no longer be the case. They would be able to leave and still have health insurance, and they could start new businesses, create new jobs, innovate, etc. Also, there's a lot of studies that show Medicare for All would create jobs. Some estimates say it would create up to 2.3 million new jobs, basically providing healthcare to people. Okay, so that's pro. Now let's move on to con. All right, reasons why Medicare for All is not a good idea. All right, so the first reason is cost. So basically, estimates for Medicare for All say that the cost would be somewhere between 25 to as much as $40 trillion over 10 years, right? The estimates vary pretty widely, but that's a lot of money. No matter how you slice it, that's a ton of money. The US budget right now is about 3.8 trillion, which means by some estimates, the federal budget would nearly double if we enacted Medicare for All. That's a pretty big deal. Basically, the impact of this, there'd be a middle class tax increase. So the CFRB, that's the Committee for a Responsible Budget, they found it would be impossible to fund Medicare for All just by taxing the rich. You would have no choice but to tax the middle class. So they did this whole study. They found you could raise the top income tax to 70%, the corporate tax rate to 42%. You could tax capital gains more. You could tax wealth. You could eliminate deductions. You could make a bunch of new taxes. If you did all of that stuff, which by the way, would almost certainly never actually pass, that would still only cover 40% of the cost. You would have to tax middle-class Americans. And some estimates say that that tax increase would have to be as much as 20% of middle-class income, which is very significant. The only other way you could do it would be to increase the debt, and the debt's already very high, so that's probably not a great idea. The basic impact is it would hurt, middle-class Americans' finances. Another reason Medicare for All might be a bad idea, there's an argument that there would be a loss of doctors and that hospitals would be underfunded. So basically what we have to understand about this is Medicare usually pays a lower rate for the same procedure that private insurance pays. So let's say, you're getting a heart transplant, private insurance, maybe they pay $1,000. Medicare for All is usually going to pay less than $100 or $1,000. That's, I don't know, $800. There are different estimates on how much less. But either way, doctors and hospitals might lose money if we went to Medicare for All. Doctors might have to undergo a pay cut. Some estimates have found that might be as high as 40%. And there's a concern that that would lead to fewer doctors, which would obviously be bad, as the healthcare system needs a lot of doctors, especially if we're starting to provide healthcare to more people. There's also a possibility of hospital closures. There was a study that was done that found over half of rural hospitals might be at risk of closure if Medicare for All was enacted. Now, I should mention, for if you're on pro rebutting this, these are pretty controversial numbers that are not widely agreed upon. So definitely do your own research and look at your own studies. There are also a lot of arguments that actually Medicare for All would help funding of rural hospitals, that there wouldn't be an issue with doctors. So just make sure that if you're rebutting this, that there is evidence out there. And then I have kind of at the end a few quicker points on why it might not be a good idea. One is wait times. A lot of countries with national healthcare programs have found that certain procedures, people have to wait a long time to get them because of the national healthcare health insurance program. I will mention this is usually non-emergency ones. So like if you're dying of a heart attack, you'll be seen quickly. These are usually for things that are not, emergencies, that this wait time happens. There's a big argument that there's basically a lack of choice under Medicare for All. Everybody would get the same healthcare plan under Medicare for All, whether you're really sick or you're really healthy or you're really old or you're really young. Everybody gets the same coverage, full coverage, right? The way it works now, Americans can choose the plan that's right for them, right? Which some people like, being able to have that flexibility. If you're young and healthy, maybe you want a cheaper plan that has less coverage. And a study has found that most Americans like their private health insurance, 71%, and Medicare for All would get rid of it and completely eliminate it. Private health insurance, gone, poof. And that might be unpopular. There's an argument about unemployment. Basically, Medicare for All would completely eliminate the private health insurance industry. That industry employs about 1.8 million Americans, so all of their jobs would go away. There's an argument that the transition time is too short. So specifically, the Medicare for All Act of 2019 says the transition would only be 2 years. A lot of people argue that's too fast, that there's not enough time to implement the system in a good way in that short of a time frame. And finally, and I think that this is an argument that more people should be using, there are other cheaper, less disruptive ways to cover everybody than Medicare for All, right? So we already have programs to cover needy people, right? We have Medicare for old people. We have Medicaid for poor people, disabled people, children, right? Right now, only about 8.5% of Americans don't have health insurance. So there's an argument that basically says, you know what? Instead of overhauling the entire system, eliminating the private health insurance that covers half of Americans, that 71% of Americans like their private health insurance, let's just expand Medicare, expand Medicaid, right? Cover that 8.5% of Americans that don't have insurance and keep the rest of the system more intact, right? You can save lives, you can take care of people who don't have health insurance without completely blowing up the system. That's the argument. So that's Medicare for All. That's the pro and the con. Thanks so much for watching, and hopefully this was helpful.